Ugh, it's like the biggest weight was lifted off my shoulder. Literally at about an 8 on the scale, and I'm at a 1 now. I really don't even hear it anymore, and the main thing is don't get frustrated and give up. I literally try everything, drops, supplements, it's crazy.
Bob, great to speak with you. We're here to share your story with tinnitus and how you got better. Could you please summarize for everyone listening of where you are today with your tinnitus, with your ears, and where you were at your worst?
Where I am today is I literally don't even realize I have my hearing aids. I still use them, just for noise. Nothing wrong with my hearing, and I don't sometimes, I don't even know I have them on, like, the other day, I jumped into the shower, I'm like, "Oh my god, I got these things on." When I'm watching TV, I wear them. Really, when I'm just alone, I don't wear them out, I don't wear them when I have company anymore, and, it's changed my life. I was literally at about an 8 on the scale, and I'm at a 1 now. I really don't even hear it anymore.
So let's go back to the beginning here. What were the original symptoms you had? Tell us about how this all started and what you were experiencing.
I had this ringing in my ears. Thought it would go away, didn't think it was anything. Once in a while, I think everybody gets it where the pitch goes up, it goes away. Mine didn't go away. It was getting worse. I looked online in my neighborhood and there was a specialist that deals with this. I went to see her and she was honest with me. She says, listen, if it hasn't gone away by now, this is probably about 5 or 6 months down the line. It's probably not going to go away. So we need to manage it. So she hooked me up with the hearing aids for noise, white noise. I started the white noise at like a 7. Right now I have it down to a 2. I went online searching and searching and searching, and I saw you guys, Treble Health, and I did a little research, and I'm like, "You know what? This seems like it could be the real deal." I saw the testimonials from other people, so I hooked in, I listened to a few, seminars, I guess you call them, that you had, and, it piqued my interest, so I got in touch with you guys, and, you hooked me up with Michelle Kennedy, who was wonderful and who I actually recommended somebody else to already, who's going through a program now, and, she was great. She literally, took me off the ledge. I couldn't sleep and, a lot of different things. I was a little ahead of the game because I already was sleeping with a noise machine and had the hearing aids. So she said, "You're a little ahead," but when I took the test that you gave me, it was pretty much off the charts, the aggravation and, how it was affecting my life. And 6 sessions, 3 months, and, you gave me the test again. She says, "You really don't need this anymore. You're doing great, but if you ever need to get back in touch with us, you're more than welcome to get in touch with us." And so far, everything's been great.
And then how much time had passed between when you first developed tinnitus and then when you actually start to see the tinnitus going down or getting better?
Took me about 3 months, 4 months to actually go get the hearing aids. Counting that time, that was about 4 months, and I would say literally after the first month, after 2 sessions, with Michelle, I saw an improvement, which really got me excited, so then I was ready to go.
When you reached out to us, obviously the hearing aids were doing something, but you still needed help. So walk me through that. You got hearing aids for most people would think, well, shouldn't that just solve the problem? I mean, why did you still need help? How do you answer that?
It didn't solve the problem because the ringing was still there. So I had literally had them turned up for like a 7. She told me not to put them any higher. She told me, Erica, where I went, the center where I went, the whole idea is not to block it out completely. It's just not to have it affect your life. So you're always going to hear it, but we don't want to get to a point where it's too loud and it's going to do damage. So she said 7 is the highest she would recommend. So after that, maybe it was a little better before I contacted you guys. But once I started working with Michelle and she explained to me, what the program is about, how to get my mind off it, I almost like I had floaters in my eyes. It's almost like that where your brain, it's a little harder because your brain automatically gets rid of the floaters after a month or 2. This, you have to do a little work. But if you're willing to put the work in, the results are unbelievable.
There was a 2020 systematic review study of CBT, cognitive behavioral therapy for tinnitus, and it showed that CBT significantly reduced tinnitus related distress when administered by a professional. And it did not have as clear of a benefit when it was self guided. At the same time, we do know that the research supports using hearing aids or sound therapy devices, in your case, for tinnitus relief following tinnitus retraining therapy. So, Is that more or less what you saw, that the sound therapy did something, but the other components, more of the mental, emotional CBT was really important?
100%. I couldn't do it on my own. Just I tried. I couldn't do it on my own just with the hearing aids, and that's when I started doing more research. And I found you guys, Treble Health, and you need both. There is no way I was getting through this without the help of Treble Health. This just wasn't going to happen. I tried, and it's just I wasn't getting it. It was like I was stuck in sand. I just nothing was. I got to a certain point, a little better, but it wasn't good enough. For me to get to go on with my life and do what I have to do without me thinking about this all the time.
So there's a lot of people listening that think, "Oh, Treble Health, you guys are only showing testimonials of patients who just had this for a few months. That gets better for everyone." But actually, no.
No,
You're someone who have had this for years.
I had it since April of 2021. It took me a year to reach out to you, and actually 2024. April of 2024 is when I started the program, first week of April, and I ended it last week of June. So it took me a while to find you guys, but thank God I did.
Yeah. And see on our own data, we measure tinnitus from 1 to 100 using something called the tinnitus functional index. So when you first started with us, your score was a 68 out of 100, which is a very serious problem. And by the end, when you finished the most recent one you took, it was a 3 out of 100.
Right.
So tell us about how that process of gradually getting better. What was that like for you?
Oh, it's like the biggest weight was lifted off my shoulder. Once you start seeing results, it starts moving along, but you have to believe in the program. And as soon as I started seeing results, which was pretty quick for me, according to Michelle, literally after the second class, second session, we'll say, I started seeing, slight improvement, and it just took off from there. And it's really unbelievable.
So tell me about what did you do in those sessions, or what did you learn in those sessions that you practice in your day-to-day life?
Well, she had me go do a couple of exercises. One was meditation, small I'm not a big meditator, but I tried to do it. And I did it even though I didn't think it was working for me, I still went through with the meditation. 5 minutes in the morning before I get out of bed, not a big deal. I would sit in the yard and just concentrate. Like she said, like, concentrate on doing puzzles. I'm not a big puzzle guy. So I would go in the yard and just look at the birds, look at a tree, and anything to take my mind off of it. Trying to retrain, my brain, I guess, or my mind, not to listen to this noise that's in my head. And believe me, I was skeptical at first, but once you start seeing results, it's really unbelievable.
So this wasn't just you getting used to it or choosing to not care about it. Is it correct to say that the sound that you experience is softer, it's quieter? Tell us about that.
Much quieter, much quieter. It's like that test showed. I mean, like I said, my test is, when I had the hearing aids in right now, actually. I went from a 7 to a 3. I'm keeping track of it. I'm about to drop that to a 2 because I think I can. I tried to drop it to a 2 about a month and a half ago, and I'm like, "You know what? I don't wanna fool around with this," and I went back to a 3, but I think I'm ready to drop it to a 2, and I'm gonna be honest with you, I think eventually, I'm not even gonna need these things.
Yeah, that's the goal, because what you're using is sound therapy in your ears. You're using hearing aids to present sound therapy. And for patients who have normal hearing or no subjective hearing loss, really, then we often use devices like that to play sound therapy. I wanted to highlight that, generally speaking, at the end of tinnitus treatment, which it seems like you're nearing the end of, quite frankly, if your tinnitus is so, once you're at the end of tinnitus treatment, then you get to the point where you don't need to use the devices on a daily basis. And at that point, you're essentially back to normal. I like to use the analogy of, if someone has a knee surgery and they get knee rehabilitation, right? They're using a knee brace for a period of time. And then once they're close to 100%, they can take off the knee brace and they can they can play some sports. They can play with their kids or their grandkids. They can be back on the field, but they're not necessarily 100%, right? They're still a little cautious. They're a little cautious, and they're a little aware that their knee's not what it used to be, but their life is essentially back to normal. How does that analogy sound in terms of where you're at?
100%. I mean, I don't think I mean, I know that unless they come up with some miracle cure that this is gonna be with me for the rest of my life, but I'm managing it, and that's the key. That I'm managing it, and it's not affecting my life, not affecting my playtime with my grandchildren, anytime with my wife. It's not affecting anything at all.
That's great. What advice would you have for someone who is still really struggling with this, who's maybe had it for a few years? Maybe they've also tried hearing aids and they've helped a little bit, but obviously this is still a problem for them. What advice would you have for that person?
Can't do it on your own. You really need help, you need someone that knows what they're doing, and without a doubt, Trouble Health is, you guys know what you're doing. Um,
Thank
I
you.
mean, you you I that's I mean, that's the testimonial. It's just it works.
What about for someone who maybe can't afford private services? Any quick tips for them who's listening of what's a few things they could try, today or this week that might help them move forward?
Yeah, sure. I mean, listen, the hearing aids aren't cheap, but a sound machine is. You can get one on Amazon for $30. And just you can still go through the program. If you can't afford the hearing aids, you can still go through the program. And I mean, I had them, so I'm not going to say that it would have worked for me without the hearing aids, but I think it would. It might just maybe take a little longer, but just really concentrate on the exercises that you guys give out, and you got to stick with the program. And the main thing is don't get frustrated and give up. I mean, you just got to keep trying because after two, I wanted immediate. I'm the type of guy that wants, I need results of the day. And you got to get past that and say, yeah, all right, let's give this a shot because I literally try everything, drop supplements. It's crazy.
So right now, if you're in a quiet room, like your home office right there, when you take the hearing aids off of your ears, how would you rate the loudness of your tinnitus on a 1 to 10 scale?
It's really like a 2 all the time. I mean, I just have them in today because I actually forgot to take them off before I came up here. But when I'm trading, trade stocks, when I'm doing stuff or I was watching a little TV before we got on, I'll put them in because that's what she told me to do. So I play with it. Like, sometimes I won't wear them when I watch TV, and it won't be bad. But I notice there's certain you have to also big thing is you have to realize what the triggers are. For each person's different. My triggers are stress and alcohol. I'm not talking like I'm a full-blown alcoholic. I'm talking about even just 1 or 2 drinks. I know that if I have 1 or 2 drinks with my friends on, going out, that either that night, going to sleep, or the next morning, it's gonna peak a little bit. But knowing that, I also know that I have it under control and I'm gonna get it down, and it hasn't failed me yet.
That's really good awareness. So what you're suggesting there is that you had tinnitus for years. It was really bad. You started a program which included sound therapy and then eventually also more CBT, cognitive behavioral therapy approach. You essentially got professional help for this in a comprehensive manner. In less than 1 year, your tinnitus went from, I believe, what you described as an 8 out of 10 level down to where it is now a 2 out of 10.
It wasn't even a year, it was 3 months.
So, what does this show us? I mean, is tinnitus treatment possible? I mean, this is your chance to share to others who might have doubts or need to hear it.
It is 1,000% possible, literally losing it. And I took MRIs and everything else, and they said there's nothing wrong, maybe, we could maybe that it was a nerve issue, and that's not what it was. It's just like I said, you gotta stick to the program. It works.
All right. Well, this is really inspiring. And particularly for anyone listening, just know that Bob had this for a number of years. This wasn't just the natural course of things. How could someone have this really bothersome for years and then it gets better within months? Suggests what he did in those months was important. Maybe also what you stopped doing in those months. Do you want to comment on that? Maybe you stopped doing certain things?
Wait, the one thing I that helped me tremendously is to stop stressing out about it. When I finally got in touch with Treble Health and I saw that I think there's a path here where this is gonna work, it completely takes the stress level away. And like I said, one of my triggers is stress. It's a combination of everything. It's the hearing aids, the sound machine, definitely following the program and bringing that stress level down because I think we all have stress in our lives. Some people have it in different extents more than others, but that's what really I think was the key. Once I saw that there was a window where I think this could work. I was a totally. My wife says, You're like a totally different person," and I said, "You're not kidding. I feel totally different."
I love that, Bob. Well, keep it up. So that's your path moving forward. Just stay healthy, keep a good nervous system health and overall healthy state of mind and body. Get good sleep, take care of yourself, wear earplugs around loud noise, and I don't think this tinnitus is gonna come back. It's very rare for tinnitus to relapse, so just keep things on the right track, and you should be completely safe.
I'm very, very confident that I have this under control. Now it's been months. I mean, it's been like 4 or 5 months where I'm a totally different person.
I love it. Well, Bob, thank you for sharing your story and hope to maybe meet you in person one day. So thank you so much.
Great. You.
If you'd like to explore which tinnitus solution is right for you, book a free call with my team at Treble Health. We can meet over Zoom and discuss which option is the best fit for your treatment. Click the link on the screen right now, and we'll see you on the free call.